In terms of the paediatric history, what you want to do is introduce yourself as normal and explain what the consultation will be about if necessary. You want to ask who the child is with and who they are, what their role is, whether they're a parent or a relative. Then you want to find out about the presenting complaint, so just find out all details. The acronym Socrates might be of help here. And then you want to go on and I guess find out the ideas, concerns and expectations of the parent or the child if they are old enough. Then you want to go on to do binds. So you want to take a birth history. So you want to find out what the birth weight was of the child, what the length of labour was, if there were any interventions that were involved, whether there was premature rupture of membranes, whether there's a fever. Then you want to go on to the, I guess, the prenatal history. So you want to find out what the length of pregnancy was, whether what the length of pregnancy was. Okay, I guess, and then moving on to neonatal history, you want to find out whether there were any complications at birth, such as whether the baby was jaundiced or the baby was cyan-nosed, etc., etc. And there was something else which I'm forgetting here, but there you go. And then in terms of you want to find out whether they've had all their immunizations, whether they're up to date. And if they're not up to date with their immunizations, you want to ask them why they're not up to date with their immunizations. Nutrition, you want to find out what whether they were breastfed or formula fed, and what age they were weaned, and obviously find out a little bit more information about all of that. D, you want to see whether they were meeting their developmental milestones, such as were they smiling at the right time, were they walking at the right time, etc., etc., just depending on the patient that's in front of you. And then you want to find out the social history, who is at home, what's the living situation like, is there any thoughts of non-accidental injury, is there a chance of passive smoking, so does anyone at home smoke, if any involvement of social services. And then you want to find out past medical history of the child, whether they've had previous illnesses, previous surgery. You also want to find out about their medications. And then you want to go on to find out family history, if there's family history of certain things. So say if there's a strong history of asthma or eczema, then probably in social history you probably would have also wanted to ask whether there's any pets at home or any triggers. And finally whether there are any allergies. And then you want to go on to do a full systems review, so that's important. So you want to find out whether they've got any problem with their eyes, with their vision at all, with their hearing, or any ear problems, mouth or nose, any swallowing difficulties, any nose difficulties, don't know, obstruction, blocked nose. And then you move on to the chest, so you want to find out whether they've had any difficulty breathing, wheezing, there's been a cough, chest infections, any known congenital heart problems. Then you, I guess, want to go on to their gastrointestinal system, so you want to find out whether they're passing stools properly, whether there's been any vomiting, diarrhea, what's their fluid intake like, I guess. And then you go on to your urinary system, so has there been any pain on urination? It would be hard to tell, but any discomfort there, any urinary tract infections, any obvious abdominal pain. Then you want to check whether they've got any musculoskeletal pain or problems moving at all. Neuro. It's hard to tell whether a baby's got headaches or not, but okay, yeah. But if the child is old enough, you might want to ask whether they've got any headaches, head pain, sensitivity to light, I guess, any fits, any seizures. I think that's all for now, so I'm just going to double check.